Alright guys, how are you? You can come on really close and you can see what we're doing. We're doing Fractora, which is deep microneedling radiofrequency. And on his Asian skin type, we have to be really careful with laser treatments, although we've really perfected, I think, how his skin responds. But you can see if you come in really close, there's all these little dots. Those dots are leaving little pinpoint bleeding. That pinpoint bleeding is signaling that we got really deep into the skin. He's doing quite amazing. He's done this before. Going over scars that he has a little bit deeper. This doesn't feel great, but with the right numbing, you know, I've looked at his pictures of the punch excisions and temple scars that we've treated before, and it made a big difference. We're probably going to end up doing another ablative laser, and I think we'll get really close to where we want to go. But the needles go into the skin. This is a 24 pin. And you can see there's different levels of needles in terms of amount and coating. If you're nervous about the skin type, turn a little bit this way. We can use a coated needle to protect the surface of the skin. With him, I'm actually doing a really strong, deep needle here. That's why we're getting a lot of the pinpoint bleeding. But we want that so that it really remodels the skin for him. Are they asking anything?
Which is better, Fractora or 3 deep?
Well, 3 deep that's RF actually. If they're asking about EndyMed intensive, we like the Fractora better. My patients find that they see more of an outcome from it. It's a little bit more power, although the new EndyMed Pro is really good. My patients still tell me this is the one they like the most. You're doing great. Deep breaths. And we're really just following very close rows and columns, so we make sure it's very even. After a series of treatments, it really improves. I do this myself every couple months just for skin tightening purposes. And this will help overall remodel his skin. Given that the RF technology goes into the deep part of the skin, it actually really helps acne. Some people get a little bit of milia afterwards, which is sweat gland occlusion. That's why the aftercare is so important, doing exfoliating cleansers, masks, etc. Almost there. So he's doing this as part of a long-term plan. We're really trying to rebuild his skin after it was damaged. I'm going to do an extra pass here, these scars here. And you see we're doing double pulsing, in some areas double passes. I'm very happy that he's been sticking with the plan, because he was very nervous before because he was damaged by another place. So we've really been working hard to change his overall skin quality, and I think it's done very well. I think he's, in the early phases, even though we've done a bunch of treatments, I really think it's gonna change a lot more.
What's the downtime?
Well, for this level, it'll be 3 or 4 days of a little bit of redness. You might have some little dots on the skin. Turn all the way to the left. Last part, we're doing just this side now. Little dots, but it's not something where you really have to stay home unless you really want to. I mean, this really can be covered with makeup. We're spreading the skin so you get a nice firm application. Extra passes.
Can you talk about the differences in results from Fractora versus Morpheus 8?
Yeah, Morpheus 8, I always tell people, is more for just tightening. You want to remodel the skin, you're going to get tightening from that. If you're a little older, or if you have really sagging, a lot of sagging. If you want textural improvement, sort of for scarring, pore reduction, etc., that's the Fractora. So I think Morpheus is better for combining it with skin tightening procedures, or if you're going to do it with a laser and you want to get tightening, we call that a tighten bright. Do your nose really quick. Whereas for him, I really need to focus on remodeling where the scars are. Turn it this way. And those are at a different depth. That's not as deep. If you have jowls, if you have neck hanging, that's where the Morpheus is. You feel it right above your lip. A little bit more above your lip. You're almost done. Now I'm just going to check around, going to look and see, go over extra passes over where some of the scars are. And then he's done. Yeah?
For anti-aging, would you recommend Fractora, 3D, Infinning, or Profound?
That would be a consult that you need to have with me. It's too detailed of a question for me to answer on live. They're all different microneedling devices used for different purposes. But I do myself Fractora every 2 months. Last week. Beautiful. All right, so he's good. He's done. Okay, so that's Fractora. If you guys take a look, he's just red. I did about 6 passes over the deep scars for him because I really want him to get a good improvement. You see there's little dots on there. Other than that, he's perfect. We're just gonna get him some medicine, mask, and cooling, and he's all done. That's Fractora.